Hi, everyone. I'm here with Dr. Nario for our weekly discussion. Thanks for being here, Doc.
Hi, Steve. Happy to be here. Happy New Year to everyone.
Merry New Year! What
Merry
movie?
New Year.
What
Combine
movie?
everything.
Eddie Murphy, Coming to America. No, no,
That's
no.
how we do
Trading
it, right?
Places. Eddie Murphy, Trading Places. That's what it was. They're in the elevator, and he goes, Merry New Year! And the guy in there, the bad guy gets all pissed off because he's not saying it right. So, anyway, Dr. Nario is at Biointegrative Health Center in Reno, Nevada. You can check them out online, see all the different treatments and things that they do there. All right, so we're going to talk about collagen. Collagen, there's collagen in a lot of the food that we eat, but the main importance of collagen is what does it do in our body, because our body forms collagen, right?
Mhm. We have collagen and we can get collagen in.
Right, but it makes it from amino acids, right?
Yes, that is right. That is correct.
Okay, so just let's start off with why is collagen different than other proteins?
Okay. Well, again, Steve, welcome everyone. And this is something that one of the more popular supplements, if you think about it, in anti-aging medicine. So collagen. So if again, you can add it in your coffee. It's always known to fix skin, joints, hair, and nails, and even your gut, or not your love life. Or I wonder if it's also if you're just drinking. Of course, are you thinking? I have a lot of questions from patients. Am I just drinking expensive powder, or is it the real deal? So you're in the right place. We're going to discuss that today. And again, we need to give a good differentiation here somewhere between the magic or the marketing aspect of what is collagen. So, and what is collagen? Let's start with that. It's the most abundant protein, as you mentioned. It's basically the scaffolding that holds us together. It supports skin firmness and even elasticity, joints, tendons, and ligaments, bone strength, gut lining, blood vessels, hair, and nails, as I mentioned a while ago. And here's the problem: after age 25, collagen production declines. By age 40 to 50, breakdown exceeds production. So, translation here: you're not aging, you're losing structure. So, wrinkles, joint stiffness, sagging skin, slow recovery, these are collagen problems.
Wow, I'm not aging. Now,
You're different.
first of all,
You're different.
don't we have to get around this problem? If we eat collagen, our body's going to take it apart, right? We're going to digest it.
Yes,
So
that's
if we
right.
eat collagen, we're going to have a bunch of amino acids in our amino acid pool, right? So is there a way to get it to, I don't know, how do we get collagen in our body if we eat it and we're just going to digest it? So how do we do this?
All right. So that's an important myth busting moment that you just mentioned right there. So when you swallow collagen, it does not float magically to your face like Botox on Uber Eats, right? Your digestive enzyme breaks collagen into amino acids, as you mentioned, especially bioactive peptides. And these peptides act as signals telling your body, hey, we're low on collagen, time to rebuild. So collagen supplements don't become skin, they stimulate your body to make more of its own. So again, this is what we like, natural ways of stimulating self, right? So that's the basic concept, I think, of what you mentioned.
Okay, so
Signals.
how do we get collagen as a peptide then?
Well, actually, it is the smaller pieces as you break it down. It is made of small proteins and peptides. That's right.
Okay, so how do we get our body to produce more collagen?
So again, this is something that as in a supplement form. So again, we take it. Not all collagen are the same. We have to remember first. Let's go to the basics. The main types that you always hear is the different types of collagen. We're not talking about the sources yet, but the collagen that we have in our bodies. Type 1. So there's so many collagen types, 1 to 10. I'm just gonna make sure that we understand 3 because those are the most important in relation to the supplement world. So type 1 would be skin, hair, nails, and bones. And then type 2 would be cartilage and joints. And then type 3 would be skin elasticity and blood vessels. And most supplement types would be containing only type 1 and 3. It's great for anti-aging. Joint-specific products may include only type 2. And key distinctions here would be you will be hearing the words hydrolyzed collagen peptides, meaning easiest to absorb. Gelatin forms would be partially broken down, and you would hear raw collagen sometimes, which is mostly marketing poetry. It's not really something that is proven beneficial on studies yet.
So, what about the copper peptide? Does GHKCU, I'm sure you're familiar with that.
Yeah,
Does
yeah,
that signal our body to produce collagen?
it does. So as part of the stacking that we have here, copper is actually one important mineral that actually is needed to form collagen. The process is called collagen synthesis or formation. So GHK copper by itself is a peptide that I use for aesthetic purposes. This is something that you can take orally, but also injected in specific areas. But the concept here is even when I use GHKU copper on patients, I always want to make sure the stack is there. So what is the stack? The collagen synthesis requires vitamin C. That's non-negotiable. You need vitamin C in there. Adequate protein intake. So it's not just the collagen. You need to have dietary sources, good dietary sources for that also. Zinc and also copper. So those are the two minerals that are very important. And you want to make sure you have low chronic inflammation that destroys collagen in your system overall. And this is something that supports healthy aging, preserving mobility, supports gut integrity, improving connective tissue resilience, and even helping prevent frailty over time. So that's the basic stack. I didn't mention any peptides. I didn't mention any bioregulators along with that, but that's just the basic if you're using collagens as your supplements.
So, at the clinic, you have a protocol for people who want to build collagen and they want their skin to look nicer or shinier. It help your care, right?
Yeah.
So that's all collagen, and you say we have less. It's not necessarily because we're aging, we just don't have as much collagen as we get older.
Yeah, it's really more of our capacity to create it. As we, of course, any aging mechanism actually gets affected through time, right? And as I mentioned to you, our habits. We don't get much vitamin C. We don't take much protein. We don't eat a lot of or take zinc and copper in our food sources. Just because we are always the holiday season, as a good example, we're not sticking to our regimen. We're more inflamed after the holiday season most of the time. But again, this is something more of a multifactorial intervention rather than basing collagen's benefit by itself.
That totally makes sense. And I guess you have a lot of patients that come to you that say, "Hey, I want to strengthen my joints or I want my skin to look better." But they have specific things that increased collagen would benefit, I guess, right? You have a lot of patients like that?
Yeah, yeah. And we actually, we have it in different modalities here, injectables, orals. So there's so many ways in how we can give collagen. But the bigger kicker here is the source. All right. So let's talk about the sources of collagen. So the most common is cow. So that's called bovine. And this is from cowhide, bones, and even cartilage. So it's containing more of the type 1 and 3 and is best for skin elasticity, wrinkles, bone density, and even general connective tissue disorders or supports. And why is it so popular? Because it's the closest amino acid profile to human collagen, high glycine and proline, meaning more skin and bone signalings that you would produce from this, and cost effective is there and widely studied. There's a lot of backing on this one, and again, best for anti-aging, skin, bone, and even general longevity. The next one is a pig, to porcine. So it's from pig skin or connective tissue. Again, type 1 and 3 is the more predominant component. It's for skin regeneration, wound healing, surgical recovery, and most similar to human collagen structurally. Frequently used in medical collagen matrices and even wound dressing. So we use that in the hospital for burns. And the downside, though, is less commonly labeled clearly in supplements. And even cultural and religious restrictions for some patients. So you're going to be here halal, right? This is not something that's for them. But again, clinically widely used in biomedical implants because of the compatibility to humans. The other one is fish or marine, and they come from skin and scales of fish, but only type 1. So now, as you can see, as we go down the line, you get less and less. So this is like the less quality ones, and this best for hydration, skin hydration, fine wrinkles, hair, and nails. So as you would see, It's more for aesthetic. And these are smaller peptides, but faster absorption and good options for our pescatarians. So the ones who are picky about their diet and it has a less joint and bone support, it has less hydroxyproline content, and most of the time more expensive per gram compared to the bovine and the porcine. And this actually, again, as I mentioned to you, cosmetic and skin aging are the beneficial uses for such. So those are the three. There's chicken also. There's even eggshell, but those are the three top sources that we recommend to patients.
Isn't there a lot of collagen in bone broth?
There is, that's right. So bone broth is, as you can see, most of this are cow based, and bone broths are something that I would suggest for patients who has gastric or GI issues, especially if there's Crohn's, IBS. If they're in the remission phase that needs cementing, collagen will close those gaps again and let those lesions heal faster. So yes, but again, bone broth. The issue with bone broth is you have to remember when we look at the recommendations for collagen, the things that we always want to make sure really would be the source, third party tested, low heavy metals. So when you talk about the bone marrow, this is where lead, aluminum goes into, and not only for humans, but it applies for animals as well. So you have to make sure that's it's a third party tested product or bone broth that you're getting. And then also, again, low in heavy metals and vitamin C sufficiency should be there in the one that's who's receiving this. And there should be consistency in relation to 8 to 12 weeks of intake for the peptide. And also the dose would be around 10 to 20 grams. And you always want to get hydrolyzed.
Okay, so I guess the more obviously protein's important because that's what your body's going to make collagen from.
Right. That's correct. And yes, always, as I mentioned to you, as we get older, we need more protein, not only for the collagen, but always like it for the muscle that we need to retain.
Hmm. Yeah, very interesting. What about, is there something topical? I know there's a lot of copper. I don't know if they work. I mean, a lot of copper skin things that have collagen that where it doesn't get taken apart in the digestive system. Is
hmm
there things that have been proven to work that you can put on your skin?
There is. So GHQ copper is now part of actually topical forms in terms of creams, ointments, and gels because it's so easily absorbed on the skin. And that's why, again, when you talk about GHQ copper, you still need the basic foundations of the ones that I just mentioned to you. It's just one of those components that actually works. I mean, if you have the right amount of the other components in your system. But yes, you're correct. Topicals are there. I would even suggest that more versus because majority of our population, our guts are not in the best of shape. And we're talking about collagen supplements that's going to go through your mouth and needs to be digested. So if you have leaky gut, you're basically not digesting that collagen that gets in there. You're not absorbing that properly. So GI, there's so many variations in terms of absorption. But topical is just going to go there directly.
Yeah, so once you eat the collagen, your body's gonna take it apart. It could make something else, right?
That's true. It would not even be it could be even thrown out. So
It
who
could make
knows,
some
right?
other peptide if it wanted something else, but, I mean, I guess you've got the right ratio of collagen because that's what you ate, right?
Right, right. So either way, again, but there's so many different modalities. If I know your gut's so pristine, I definitely would promote oral collagen forms for the patient.
So if you fix the gut, you pretty much fix a lot of things, don't you?
For sure. Hey, that's in the ideal world. Our guts are like, as we say, the second brain.
And I'm asking you this question off the wall, but do you have any idea? It seems like it's a pretty big percentage of people that need to improve their gut health.
Mm-hmm. Right? Yes. So
Do
good.
you have a guess as like half, or I know it's a wild
Oh,
guess.
to be honest with you, majority of us really, I'll put it in my clinical. I don't. This is not from a clinical study, but it's more of my clinical experience. I see patients, and I can rank for you 80% with gut
That
issues.
doesn't surprise me at all.
Right. So it's really a huge amount of number that again, yeah, I guess it's a guesstimate rather than a real number that I can give you.
Yeah, I expected that, but I thought the same thing you did. I just was curious what your guess was. So, you use different peptide and collagen products for your people that want the benefit of collagen in their body, and I guess everyone's different. You have different protocols for every person. I mean, at least a little different.
Yeah, I mean, again, with collagen, as I said, as you would hear me talk about the other components, I just don't give collagen by itself. Vitamin C, zinc, copper, those are things that I need to make sure that it's there. And again, for IV therapies, I want to make sure amino acids are part of that as well. It really depends on the patient how they present, but I want to present patients that collagen is not the one time fixer of all the problems. You need to understand that it's a component that helps improve the outcome of collagen synthesis. So it's just one big part. That's my lesson for everybody here.
Yeah, that is very interesting. Great stuff, Doc. Do you have any last thoughts or anything maybe I didn't ask that you would want our audience to hear?
Yeah, well, again, collagen supplements don't turn into skin or joints directly. They act as signals telling your body to rebuild connective tissue. So, our choices out there: bovine, marine chicken, egg membrane. Bovine is and porcine are the more common ones. Just make sure it's third party tested, low heavy metals. And make sure, of course, you tell your doctor about this, that you're doing this, what in terms of what interactions of your medications and other supplements that you're taking. But overall, very safe supplement and it's very helpful.
That's great. It sounds like what you're doing with your patients, just giving them a big support system type protocol to help them
Right.
increase
That's right.
collagen.
That's right.
All right. Well, Dr. Nario, as always, we appreciate you being here. Thank you.
Well, thank you, Steve, for having me. As we all know, that knowledge is power. And thank you for letting me provide you with the edge of longevity and health maintenance, which I call the biological edge or the bio edge.